Welcome to the Executive Innovation Show podcast, where we bring you real executive conversations with industry game changers and thought leaders. We ask the questions you're thinking, what you're scared to ask, and we make your brain hurt afterward. With your host, Carrie Chitsey Wells, co-founder and CEO of One Touch Video Chat, live video interviews, and the nonprofit Humans Helping Humans.
Hello, everybody, and welcome to today's podcast. We have a great podcast today with two amazing guests, and we're going to be talking about creating engaging mobile apps to drive virtual care. Our first guest we're going to be talking to today on the show is Jillian Bridgette Cohen, who's the co-founder and CEO of Virtual Health Partners, which she founded in May of 2015. She brings over 15 years of experience in the medical industry and is responsible for multi-million-dollar growth of 3 startup companies with a focus on non-invasive, the weight loss space. Later in the show, we're going to be talking to Robert Armstrong, who's an entrepreneur, technologist, and investor. He serves as CEO of Appstem, a San Francisco-based digital product agency, and was named top 50 digital innovators by DataBird, a leading tech business journal. Jillian, welcome to the show.
Thanks, Carrie, so much. It's been great getting to know you, and I'm excited to be on today.
Well, great. We have some awesome topics to talk about, but I really want to talk about the backstory of why you created Virtual Health Partners in the nutrition and dietary space.
Yeah, no, absolutely. So I was originally in finance. I was one of those people, and I'm the only non-doctor or medical person in my family. Everyone else was always taking care of patients and on call. And I realized or thought I might want to go back to medical school. My dad kind of laughed at me because physics and studies were not my thing. And I'd had to go back to undergrad. And I ended up in the world of medical devices, which I knew the pharmaceutical side because my family is really on the internal medicine piece. But I did not know about medical device sales, where you actually got to be in the procedure and got to really help create novel technologies and help aid in the surgeries and procedures that are going on. So it was an awesome opportunity. I first worked for J&J. I was in their management development program, and then I ended up at a startup. I learned about startups from an ex-boyfriend. I always say thank you to that. They're good for something. And I, from there, got to know a lot of the key opinion leaders within the GI and weight loss space. And I ended up going overseas to get experience within, the regulatory process and also understanding the building of the business from ground up. And during that time frame, I was very curious what happened to a procedure called the lap band. And it was literally people waiting out the door to have it done. And all of a sudden it became a bad word within the bariatric weight loss surgery space. And bariatric surgery itself also stopped growing, but the incidence of obesity was increasing. So you're like, why is this not correlating with each other? It should be growing if obesity is growing, right?
Right.
And, while I was abroad, I had the pleasure of meeting a few of the guys who were early stage within Uber. And I was amazed by this app called Addison Lee in London. I was at a Benihana when I met them. It was always a good story. Everything starts with Benihana, apparently. Or maybe in my life, just because I love hibachi. Guilty pleasure.
Yeah.
Who doesn't like a flaming volcano rice tower, right? Or onion tower?
Or the onion. Don't leave out the onion.
I cannot leave out the onion. So from there, I ended up coming back to the States after distribution and sales had been set up and some of the key opinion leaders. And I worked for another company that was doing endoscopic procedures to repair weight loss surgeries that had failed. And I go, someone's really got to go and create the Uber of nutrition, where it's at someone's fingertips, but it's actually engaged in part of the ecosphere of care within the health system or the health channel where that patient is coming from. The intragastric balloons, we actually are partnered with Obalon, which is an air-filled balloon. It sits in the stomach like a breast implant temporarily. They were coming to market and the FDA was starting to approve them, but they were requiring that you actually had aftercare or nutrition, lifestyle modification, and fitness support. And I, at that point, said to our co-founder, who's a very successful bariatric surgeon, Dr. Sean Garber, and I was like, somebody needs to create this and start this. And he goes, let's do it. And from there, it's really evolved. And what's amazing to see is that we do the same thing. We do live virtual nutrition, fitness, and lifestyle modification across multiple verticals, everything from supporting patients with cancer to patients that have Crohn's disease, obviously weight loss with weight loss surgery, weight management. We support wellness patients with cool sculpting and liposuction. And then we also have some great relationships within the fitness space where we partner in with university hospital centers, fitness equipment manufacturers, and also gyms or fitness clubs to be able to do true MedFit programs and bring that all together virtually.
Well, that's awesome. And you guys have done such an amazing job. I want to talk a little bit, you mentioned a little bit earlier, but with the, kind of Uber nutrition model and, obviously the industry is moving more and more to, telehealth and so forth, talking about all the different verticals you're kind of seeing of, consumers wanting that virtual nutrition and dietitian and, how should I cook? How do I lose weight? So it's not just a fad and it's more of a lifestyle and maintaining it. Where are you seeing kind of like the most growth from the consumer standpoint of wanting that virtual nutritionist to, talk to and coach them through this process?
I think it's interesting because consumers as a whole, they don't think about nutrition and how it affects what's going on, right? You might think, oh, I need to lose weight or I need to do this, but you don't recognize exactly that what you're eating affects how you're feeling, right? So whether it's not a necessarily weight loss situation, but God forbid you have something like Crohn's disease, right? There's a lot of foods that cause flare-ups to occur or can aid in that flare-up happening, right? Which causes hospitalization, etc. And the fact that nutrition, diet, lifestyle modification, and fitness can all play such a vital role in a disease is secondary to what we're taught. And even doctors only have like an hour of nutrition in med school. It's kind of crazy, right?
Yeah.
And so what we've really looked to and understood is the fact that it needs to start within the ecosphere, within the medical or health club situation or, medi-spa situation, where you have somebody who's actively seeking something that can be aided or improved with nutrition, lifestyle modification, and fitness. So we look at everything from cancer. God forbid you get that horrible diagnosis, but, people are like, oh, well, I need to keep weight on. I don't need to lose weight. Why do I need nutrition with cancer? But nutrition is a vital component because you're having trouble eating if you have to have chemotherapy or radiation, right? And you're also losing weight or you're having mouth sores or nausea, and you need somebody who can help you and who is specialized in being able to provide that skill set that can help keep you out of hospital and that can help keep you on your treatment regimen of chemo. Because if you can endure going through chemotherapy, you're able to have, a lot stronger of a chance of remission and everything else. But nutrition can be such a vital part of that, and fitness too.
Yeah, no doubt. And I wonder, have you gotten into the renal care side? I know it's so huge with dialysis patients. My dad is on dialysis, and it seems like nutrition drives so much of how he feels, just with the potassium and the sodium intake. And there's, so many foods that a lot of these dialysis centers and so forth are now having, dietitians and things like that. But it's just so tough, with patients that are, going to dialysis and so forth. And then, obviously diabetes, a lot of that obviously is contributed from that standpoint. Where do you see the industry going with these managed care organizations, accountability care, your insurance, your payers? Do you see it going where they're going to start more and more? I know there's a lot of, folks coming on board to understand that nutrition, is a driver of hospitalization and feeling bad and heart disease and all this kind of stuff. Do you see them getting kind of more involved with the proactive side with companies like you and others to, start paying for that and start driving that? I know you're probably doing some of that now, right?
Yeah, I've actually been really pleasantly surprised. So when we first started VHP, I expected it to be cash pay or, where it was being part of a procedure that had some payment that was going into the hospital physician or the partner, or the medical device or pharmaceutical companies or nutrition supplements that we partner with, where they might cover the cost because they know it can make their product work better, right? But what has amazed me is that the insurers are starting to wrap up. The first insurance company, one of the Blue Cross Blue Shields out here, is actually covering it for cancer, for episodes of care, under an episode of care, which is amazing. We have Medicare HMOs across the country that are actually covering the platform for weight management, weight loss, and diabetes prevention. And we're seeing many more, including, the large Uniteds of the world, starting to talk to us where they see the need of doing this. And we're working through a pilot right now with them in a large university center. So it's really exciting for me because I never thought that we would see the insurance companies cover a full program, right? I feel like we're used to insurance companies covering a visit or an item like a prescription, but instead with us, they're actually covering a full package or subscription or what we call package offering. So it has live virtual one-on-one appointments in it with nutritionists. It will have live streamed lifestyle modification classes with psychologists and health coaches, and then also fitness classes. And it has a full on-demand library plus recipes that are all personalized and geared to that patient to help drive engagement. And how could you forget a messenger? Who doesn't want a messenger, right? Because we know we all live on our phones and message constantly. Right. And what's great is it's all contained in one app and it's all HIPAA and privacy compliant. So the insurers like it because it enables somebody to have everything in one place that they're needing. And it's specifically curated for that patient.
Yeah. And going back to the kind of the title of the podcast, creating engaging mobile apps to drive virtual care, coming from the mobile app world, there's so many folks in healthcare that are creating an app just to have an app, and, somebody downloads it, they keep it on their phone, they end up deleting it. Having seen your technology, you guys have done an amazing job, as a lot of the content that you just said really not only just being like silo focused of creating people engaging content for them to continually use the app and kind of come back with, the videos and the cooking recipes and kind of all the personalization. It's extremely well done. How are you looking at, kind of that engaging content to, keep folks engaged and coming back from a user experience standpoint to, make sure that app continues that engagement on an ongoing basis versus, some of the kind of the Fitbit or the nutrition apps and things like that are kind of more siloed?
It's funny because I was just talking to our nutrition team about this. So, you have the retention rate, which is really different than renewal rate. Retention rate is the use of the platform throughout that person's package, right? Yep. And what's amazing to us is that people are creatures of habit, right? And we see that. So their first engagement with, or their first few weeks utilizing the platform really dictates what features they use. So right. People gravitate to the messenger, as you can imagine, right? So we really do see people sustaining usage of a messenger with a nutritionist, the same pattern that they started. If they have a question about what to make for lunch or vacation or travel, that is a similar behavior that they're going to always ask, right? Or if a life event happens or they have a quick question or something pops into their brain, that comes through messenger. We see that users will absolutely use their one-on-one appointments. We have over 80% utilize all of their one-on-one appointments. And I think the reason for that is they recognize that as something of value, right? And for the piece that when I look at my own behaviors, it actually makes sense. So when you go to the gym, do you tend to do, or you work out, you pretty much get into you do the same workouts every few days, right? Same habits?
Yeah, that's why I have to do kickboxing, because it's different every day.
And that's exactly what it is. So we see users find videos that they like, right? And especially on the fitness side, and they actually, and I know I'm guilty of this too, I do the same videos over and over again, right?
Yeah.
Because I like them. I like the instructor, whatever drives it. I think Peloton sees the same thing, right? As well.
Yeah.
Like you find that person or that workout. And so what we do is we actually recognize what somebody's using, and we'll push the same instructor to them, maybe with a new workout, or give tips and goals to make it, push yourself a little bit harder or try something new. So that's actually how, but we're happy if you found something that's useful. Recipes is definitely an area that people continue to look for something different, but overall people tend to by and large stick with the same 20 or 30 food types that they consistently eat in their lives. Right. And it's really, breaking them into making sure that those are healthy choices.
Yeah, no, that makes total sense. And I think, the pushing all the different content and really understanding kind of the behaviors, a lot of time, continues to drive that engagement. So the last thing I want to ask is, you have these one-on-one coaching sessions. You talked about kind of the messaging back and forth, but you have these one-on-one coaching sessions where folks can do video coaching right through the app, or they can do the phone coaching. We've seen across the industry a lot of the phone being moved to video. What are you seeing trending wise, with your own app, of folks that want to do a video nutrition appointment versus phone? Has that changed since you started?
Dramatically. It's so crazy, Carrie. I don't know if you've seen the same thing, but It used to be so many people just wanted the voice over IP piece, where I would tell you it was like 70% of appointments were voice over IP phone calls right through the app. They still record all of our one-on-one appointments, record, so someone can go back and listen to what the nutritionist told them. What I like is only the nutritionist records, not the person. So it's always good to not have to see yourself or hear your own voice. But so it is dramatically increased, where for the first time, we're actually in the absolute reverse, where 70% are now video.
Yeah, that makes total sense. I think I get that question all the time on the, especially on the video telehealth space. And, video telehealth in general over the last 5 years has gone from like 300,000 consultations to, 7 million in 1 year. And with more and more, our Gen Zs being a video first calling demographic, now you've got mom and dads, you've got grandparents, and everybody now is used to, FaceTiming or Google Duoing or whatever. So it has really put that ease. It used to just be like business people, would do a Zoom call or something like that, right? And now it's really the consumer to consumer, consumer to company. And so I think, if we play back this podcast in a couple of years, we'll be like, what's phone? Phone who? So it'll be interesting to see how that continues to trend. So before we move over to Robert and welcome him to the show, Jillian, tell everybody where they can follow you, learn about the app, and all the good stuff.
Absolutely. So you can learn about us at virtualhealthpartners.com. We are business to business to consumer, but we're always happy to match you with a partner of ours that could be a good fit if you are a consumer who's interested in working with us. And, from that, we also have a handle on Instagram, VHP Go, and we're on LinkedIn, Facebook, and Twitter, all under VHP Go as well.
Well, awesome. Jillian, it's been great to have you on the show. Everybody go follow her journey and check out Virtual Health Partners. They're up to some amazing stuff.
Well, thank you so much, Carrie. It's been awesome being on your show and getting to know you. Really appreciate it.
Absolutely. It has been a pleasure. Hey, Robert, welcome to the show. So happy to have you on the podcast.
Yeah, thanks for having me. Excited to be here.
Well, awesome. I want to talk about, you guys develop a lot of mobile applications. You work with a lot of folks in healthcare on putting together strategies and so forth. And there's been a big surge on the healthcare side of, companies that have existing mobile applications, or even folks that are building applications from scratch, really to provide kind of that stickiness. Given we have so many apps on our phones today, there's a lot of things that people are rolling out, whether it's remote monitoring, video telehealth, virtual care components, things to provide more proactive care. What are you seeing on your side that maybe you didn't see a couple years ago that you're now starting to see more of from, your clients or prospective clients that are coming in?
Sure. Yeah, that's a good question. I mean, I think a big piece of, as far as trends in healthcare technology that we see is absolutely this telemedicine piece, where, for example, a large health system that we worked with many years ago to develop their first mobile application for patients in Northern California came back to us, what was that, maybe a couple years ago, to do a prototype around telemedicine and patient monitoring. And this was kind of a proof of concept that we built with them to go take to their executive team and kind of get buy-off to build out the mobile platform to incorporate a lot more of these pieces around being able to do video conferences and consultations with patients. And that prototype was very successful, and thus ended up building out all this functionality to be able to add those capabilities into their flagship mobile app for patients. But even beyond that, you see a lot of stuff into with kind of the emergence and trends around IoT and smart devices, in particular with patient monitoring and things like this. And you originally saw it, a few years ago with the popularity of Fitbits and Jawbone and kind of activity tracker, and it's evolved more into medical devices, everything from blood pressure and glucose monitoring, things like this. And we've worked on a lot of that stuff over the last couple of years. And again, with these devices, not only is it now the patient monitoring these data sets, but being able to make sense of this data and being able to really kind of give the patient control of this data and being able to make some sense of this stuff. And so that's been a large trend, as well as being able to add these capabilities and integration into a lot of these flagship mobile apps.
Yeah, great. And as we look at, working with customers during kind of that user experience and design portion, what are some exercises or recommendations you have when clients are looking at how to make their app sticky?
Sure. That's definitely a huge component, and there's definitely mobile apps are very popular, and some of these companies will come to us, and in some cases it's a me too. We saw, someone else had a mobile app we're thinking about doing, and it's really kind of sitting down, and what we do with our clients is what we call this discovery phase or discovery process, which is really the strategy and ideation and thinking around mobile apps. I would never recommend to anybody out there to do a mobile app that would have a lot of the same functionality as the website. If you have a responsive website out there that your patients or folks are using, you want to have a differentiator. Why as a patient am I going to go to the App Store and seek out and search for your mobile app and download it? You absolutely need to provide some utility and some value to the user that they're going to save a spot on their desktop or their mobile phone and take up space along with all the other mobile apps that they have on their phone. So really it's providing that value and utility to a user that they would want to come back on a daily, weekly, monthly basis to use that mobile app that they can't do on the current website. And so really it's sitting down during this discovery process to really look at the goal and the value of the mobile app that you're going to take the time and investment to do this, and also thinking about the upkeep and support and maintenance of something like this. It's without a doubt a platform that needs care and feeding. So I would never encourage any of our clients just to provide all the functionality on your website. Let's go do that to a mobile app. There's no value in that. But there are a lot of things that you can do in a mobile app, which is where we work with our healthcare clients that you can't do. There's some limitations that to providing a responsive website, and that's really where the value comes in. I mean, I think even at a high level, I mean, you look at from a statistical standpoint, more users, once they've downloaded an app, they spend a large majority. I mean, you're talking 85% of their time are native mobile apps versus using the web browser component. That a lot of for some of our other folks outside of healthcare monetization and things like this. But at its core, if once an app is downloaded, users typically spend more time on that. They're picking up their phone and it's constantly on them. So there's a lot of value that comes around that. And
Right.
there's things that you could do in mobile apps that you wouldn't traditionally do on a responsive web browser. And these are things like push notifications, offline capabilities, integration to the phone's hardware features, whether it's GPS components or going into telemedicine using the
taking over the camera.
Exactly. Now you can do a lot of these things, and even going back to wearables, the Bluetooth integration of wearables and being able to persistently take that data. There's a lot of things that you can do that makes a lot of sense to go to that platform.
Yeah, and I think that's critical, is really understanding, the feature set. To your point, we have a lot of clients that not as much anymore that, want to have a mobile app for the sake of having a mobile app, but then just want to regurgitate the website and, then complain that nobody's, they downloaded the app, but their usage is low. People are deleting it, things like that. And I think, a lot of the things you said are right on, that there's got to be a differentiator from that standpoint. So I want to move on and talk about, as we have the rising baby boomers and the demand for virtual care, home care, seeing a lot of kind of surge in that standpoint. There's a lot of, key areas that mobile applications, whether it's a tablet solution, whether it's a mobile app of a caregiver, something like that. And, we've got the change in home health, remote monitoring, things like that. Where do you see the mobile applications playing a part in that virtual care ecosystem, looking out over the next couple of years, if we were to wind back this podcast?
Sure. Yeah, I mean, we get a lot of the stuff that we're even currently working on has to do with this remote monitoring, and really it's being able to self-care once you leave the care facility or hospital, to be able to manage things remotely, and really mobile applications provide the perfect platform for something like this. Again, because you're able to provide whether it's push notifications or timed reminders to remind patients to input data or report or to self-treat or do to-do lists, whatever this is, because your platform of mobile phones always being on you, you're able to do this stuff, and it's easier to remind folks to put in the data that you're looking to collect to be able to make smart decisions around that. This all goes to the care team, and we've built several applications. We built last year a large one for Geisinger Health System for diabetic patients, and they're able to not only proactively push customized dietary plans to the patient for educational purposes and things like this, but they're also able to get data back from the patient when they're outside of the care facility, at home and remotely, and they're able to, from the doctor's point of view, get this data in real time, and also even to the care team. We did a mobile app. This was maybe earlier last year, maybe a year or so ago, as a study where straight out of surgery, patients were able to take photos to prevent infections. They had a huge problem with these VAD devices providing infections. And so they would actually take photos, and it would not only go to the doctor, but also the care team, whether it was supportive family members and things like this, that they were able to monitor their stuff remotely, but in real time, and they can look at the actual photos and be able to schedule appointments to come back in, or be able to do a video conference with the patient. So again, mobile apps and mobile phones are a great platform for at-home treatment because of all the capabilities, whether it's viewfinders, connected devices, push notifications, and automated reminders, and things like this. So it's really a lot of stuff that we see demand for and continue to work on.
Yeah, no doubt. And so the last question, Robert, if you were to have to think of the top, 2 or 3 kind of trends that we are going to see in healthcare from that native kind of mobile application kind of feature functionality, what do you think those might be that are coming down the pipe?
I think maybe at a high level, the three big things would be, I think one is interoperability. So there's a lot of things around healthcare standards and integration, specifically with FHIR and APIs, to be able to aggregate a lot of this information. So a lot of, and this is something that's actively kind of as we speak happening, where a lot of the patient's data is sitting in these different silos, whether it's specialists, or pharmacy, or in your EHR, or maybe a separate EHR at a different health system. And so being able to aggregate this information and provide that data to the patient, I think is one of the biggest things is that we see and continually work on. It's a lot of this back-end integration stuff. I think the second thing is with the telemedicine and remote monitoring. And this is everything from connected medical devices to be able to aggregate this data, to be able to do remote visits with doctors. And we're not talking about rural areas in the U.S. that maybe would have to drive a long way to go see a doctor. So they're able to have a lot more time with doctors, that being able to see doctors more frequently, but even being able to do a lot of this stuff remotely where you don't need to go in and see a doctor face to face. One of the prototypes that we did with Kaiser Permanente a couple of years ago was around this whole idea. And do I need to, really you kind of had three outcomes. It's do I need to schedule an appointment right now to go see my doctor? Can I do a televisit with the doctor right now? Or can I self-treat and then get directions on how to self-treat? Maybe put some ice on it or take some Advil, whatever that may be. But there's a lot of things that we can do now where you don't need to necessarily go into the facility. And then I think that the third big trend is doing something with this data. So as I was saying earlier, we do a lot of stuff now. We have Apple Health Kit, and we're aggregating activity and fitness and even sleep and a lot of this different data. And we've been doing that for years, but now it's making sense of that data. So, all right, great. I walked 10,000 steps today. What does that mean? Or I slept 8 hours last night. Taking this overall picture of collecting this data from a lot of these connected devices and making sense of it and providing proactive plans or suggestions to the patient based on their history of having high blood pressure, or maybe based on previous surgeries or whatever it may be. But now it's taking a lot of this aggregated data and being able to put it into actionable results or actionable items to be able to do preventative care stuff, I think is another big trend.
Yeah, I think a lot of those, go hand in hand and are nice kind of steps over time from a roadmap, right? Because now we have all this data from, the Fitbits of the world and all the,
Sure.
dietary applications and things like that. You have some of the ACOs and MCOs that are kind of mandating remote monitoring for your high-risk patients. They've got all the data that shows, patient A, is 25% higher than patient B in diabetes. And then there's the last mile of, okay, great, we have this data and we show that this patient, potentially is showing signs that they might need hospitalization. Let's do a telemedicine visit with them today and not wait on getting them in for an appointment next week. And how can we, proactively do care? And do they need to go to a doctor's office? Do they need to do telemedicine? Can they go to a clinic versus an ER? And so I think as we talk more about this kind of value care model that everybody talks about, what we're really talking about is, we have all this great information. How do we make it a proactive care model to really not only benefit the patient, but then benefit the payer, right?
Absolutely. And there's a lot of things that we can do based on this data and statistical stuff that can avoid people from going back to the hospital or potentially avoid going to the hospital in the first place.
Right. Absolutely. Well, Robert, it's been so great to have you on the show. Make sure you follow Robert at Appstem and make sure you follow Jillian at VHPGO. That is their social followings. If you have any questions for Robert or Jillian today from the show, feel free to submit those. Share the podcast and let us know if you have any comments. Robert, thanks again so much for being on the show.
Carrie, thanks for
this
having me.
podcast has come to a close. To hear more from the Executive Innovation Show podcast, subscribe, submit questions, and share the love. Follow us on social. We're everywhere.